Hello and welcome. Today we're diving into a topic that touches many families, gestational diabetes. Now, I know hearing that term can sound a little scary, but our goal today is to clear things up. We're going to break it all down and show you how it's totally manageable for a healthy pregnancy and, most importantly, a healthy baby.
Just a quick note before we get started. This video is based on a chapter from the book Maza Madhumeha Maze Niyantran. For more details, you can always visit www.schoolfordiabetes.in.
So, you might be wondering, just how common is this? Well, get this. Anywhere from 3 to 10 out of every 100 pregnant women will develop it. The biggest takeaway here? If you get diagnosed, you are absolutely not alone. It's common, and it's something you can definitely handle. Here's a quick look at our game plan. First, we'll define what makes this a pregnancy-specific type of diabetes. Then, we'll dig into why it even happens. After that, we'll cover diagnosis and management, what life looks like after the baby arrives, and finally, we'll answer some of your most common questions. So, let's start at the beginning.
First up, let's understand what gestational diabetes, or GDM, really is. What exactly makes it specific to pregnancy?
At its core, the definition is really simple. Gestational diabetes is a type of diabetes that shows up for the first time while a woman is pregnant. And that's the key. It's diagnosed in women who didn't have diabetes before they were pregnant. It's totally different from type 1 or type 2, which are pre-existing conditions. Now, I know what you're probably thinking. Okay, so what are my chances? Am I at risk? And yeah, there are some common risk factors, things like your ethnicity, age, or family history. But here's the kicker, the part that surprises everyone. Somewhere between 40 and 60% of women who get GDM have none of these risk factors. It can literally happen to anyone, which is why screening every pregnant woman is just so important.
And that, of course, leads to the next big question. If it can pop up out of nowhere for so many people, why does it happen at all? Let's get into the science of what's going on with pregnancy and blood sugar. The whole thing boils down to a concept called insulin resistance. Okay, here's an easy way to think about it. Insulin is like a key. Its job is to unlock your body's cells to let sugar, or glucose, inside to be used for energy. But during pregnancy, sometimes that key doesn't work so well. The cells don't respond, so the sugar can't get in. And where does it go? It just builds up in your bloodstream, and that's what we call high blood sugar.
So, why is this a big deal for the baby? Well, it sets off a little chain reaction. First, all that extra sugar in the mom's blood easily crosses the placenta and goes to the baby. Now, the mom's insulin doesn't cross over. So the baby's little pancreas sees all this sugar and goes into overdrive, pumping out extra insulin to handle it. The problem is, all that extra insulin acts like a growth hormone, which can cause the baby to grow much larger than they should. And you might be surprised to learn who the main culprit is here. It's actually the placenta. It's doing its amazing job of growing a baby, but it's also producing this cocktail of hormones. And a side effect of all these hormones is that they can mess with the mother's insulin. For most women, their body just makes more insulin to keep up, but for some, it can't, and that's when gestational diabetes sets in.
Okay, so that's the what and the why. But now for the most important part. What do we do about it? Let's talk about diagnosis, management, and how you can take control of the situation to ensure a healthy pregnancy.
The really good news here is that screening for GDM is a standard, routine part of prenatal care. You can see on this timeline that while a test can happen anytime, there's this really crucial window between 24 and 28 weeks. That's when all pregnant women are typically tested, because that's when those placental hormones are really cranking.
The test they usually do is called an oral glucose tolerance test, or OGTT. It sounds complex, but it's not. You drink a sugary drink, and they check your blood over the next few hours. This table shows the specific numbers for Indian women that doctors are looking at. If any of your results are at or above these levels, it just means your body isn't handling sugar as well as it should be, and that's how they diagnose GDM.
So if you are diagnosed, management almost always begins with what you eat. And let me be clear, this is not about starving yourself. It's all about making smart swaps. The idea is to load up on things like veggies, proteins, and whole grains, and steer clear foods that cause a rapid blood sugar spike. You know, things like sugar, white flour, and so on. And right alongside a healthy diet, you've got another powerful tool in your toolbox: gentle exercise. Moving your body helps it use insulin more effectively. And we're not talking about anything crazy here. We're talking about safe, simple things like a nice walk, some seated exercises, or even just some focused breathing.
Now, this next point is so important, and I really want this to sink in. A lot of moms worry that if they need medication or even insulin, it's going to harm the baby. But that's just not how it works. The mother's insulin and medications do not cross the placenta. So managing your sugar is truly the best and most direct way to protect your baby.
All right, so you've navigated the pregnancy, the baby is here, what's next? Well, for the vast majority of women, blood sugar levels go right back to normal after delivery. But the GDM journey doesn't completely end there. It's also a clue about your future health.
Think of a GDM diagnosis as, well, a little window into your future health. This chart shows it pretty clearly. Women who've had GDM are at a 7 times higher risk of developing type 2 diabetes later on. Now, that's not meant to be scary. It's meant to be powerful information.
Because knowing that risk means you can do something about it. GDM is basically an early warning system. It's a chance to really focus on your long-term health. Continuing with a balanced diet, trying to get those 10,000 steps in, and keeping stress in check can make a huge difference in lowering that future risk.
Okay, to wrap things up, let's tackle a couple of the most common questions that people have about all this. This is a big one, especially for anyone thinking about growing their family. If you went through this once, what's the likelihood it'll happen again?
Well, the numbers are pretty straightforward. If you had GDM in a past pregnancy, you have about a 41% chance of having it again. Compare that to someone who didn't have it before, their risk is only around 5%. So yes, the risk is definitely higher, which just makes that healthy lifestyle between pregnancies even more important.
And for our last question, let's zoom out a bit and look at something really fascinating that connects our health across generations. What's the link between nutrition early in life and the risk for diabetes later on? And this all comes down to an incredible concept called molecular memory. The basic idea is that what a baby experiences nutritionally, even in the womb, can actually program its body for the future. So if there's a period of malnutrition, the baby's body might learn to become super efficient at storing fat. Then, later in life, if that person has plenty of food and a less active lifestyle, that same programming can lead to a much higher risk of type 2 diabetes. It's just a powerful reminder that managing your health during pregnancy is about so much more than 9 months. It's about laying a healthy foundation for your child for a lifetime to come. Thanks so much for tuning in.